if you're wondering why you always get hurt when you're doing your training runs, there's a number of reasons that could happen, and without seeing you, that's kind of hard to tell. But here's a couple things that are pretty common with people with running injuries. The first is shoe wear. Everybody needs individualized shoes. You have different shaped feet, you have different body types, you have different running types. So by going to one of your local shoe stores and getting the right shoe for you, that'll help decrease your likelihood of injury. Another thing is knowing when to retire your shoes, and that's usually around the 300 to 500 mile mark, because if you're running on shoes that are broken down, then that's going to change your biomechanics and change the pressure that it puts on your body, and then increase your likelihood of injury. The next one is running surface. If you find that you're running on sidewalks all the time, or if you're running on the same side of the street all the time, then your likelihood of injury is going to increase, just because the one surface is hard, the other one kind of puts your body at an awkward angle. So by mixing it up, make sure you take your rest days, you're doing your cross training, and then running either on the treadmill or on the track, and that'll help decrease your likelihood of injury for there. The next one is weakness. With runners, a lot of times it's hip weakness and core weakness that leads you to poor running biomechanics, and then will increase your injury rate. And then the next thing you do for that is, obviously you're going to strengthen your hips, strengthen your core, and really focus on running correctly. And then finally, which is the most important one, is overtraining. You want to make sure you stick to the Norton Sports Health Training Program. You want to make sure you take your rest days, do your cross training, advance your mileage at a slow rate, because if you jump too far, then you're going to hurt yourself. And then that should help decrease your injury rate. And then finally, if you're still having those injuries, I would get checked out either by your physician or your physical therapist to see what else you have going on.